Hello, and welcome back to All Therapists Are Jerks with Ulland
and Jo.
In today's episode, we're going to be talking about the 5 dysregulations, which is something that's central to dialectical behavior therapy, but also to life in general. So I don't believe that anyone who benefits from DBT has something fundamentally broken within them. I think we all have a tendency to become dysregulated at certain times, and some people might suffer dysregulation to a point where it becomes dangerous and treatment might be necessary. Linehan got a lot of her ideas and change strategies out of cognitive behavioral therapy and behavioral therapy in general. So some of this is going to be familiar to those of you that do know something about cognitive behavioral therapy. If you kind of imagine a triangle in your mind, and on the top of a triangle or mountain, you have emotions. And then at the 2 lower corners, you would have behaviors, and then you'd also have thoughts. So a classic idea within cognitive behavioral therapy is, if you're in a mood state or have anxiety or depression, that you can go about changing the way that you behave or changing the way you think, and that would eventually change your mood. So an example might be if you have social anxiety, you would need to behave in a way that you had confidence. So if you act as if you have confidence, you'll eventually be less anxious and experience more confidence. Or you could also decide to think more confident thoughts or to begin to challenge some of your insecure thoughts. And in that way, you would also notice that would improve your anxiety as well. And also the way that you behave and the way that you think, both of those also affect each other. So often if you change the way that you think about things, your behavior will also follow suit. Or if you focus on the behavior, which can be sometimes the easiest thing to do, is that can over time change your thinking and your emotion. The reason I think of emotion at the top is because it's very hard to affect emotion directly. You can't really choose to not feel something. So if you're an anxious person, you're like, well, I'm not going to feel anxious anymore. It doesn't really work that way.
Right.
So emotions are probably some of the most automatic things that we have, whereas behaviors and thoughts are actually quite automatic too. However, I think that we often have more ability to have an effect. So that's more like what I call the cognitive behavioral therapy triangle or triad. In DBT, we're looking at kind of like we talk about like enlarging the circle or stepping back a bit more, trying to make something like a bigger picture. And so we're concerned with relationships. So cognitive behavioral therapy is very concerned about the illness or about behavior and about the individual. In DBT, we're looking at so how do those patterns then affect relationships? So if you think of a triangle with those 3 things in it, and then draw a circle around that triangle and then put relationships, that becomes ultimately very important, that circle. And then also within DBT, because it was initially designed for individuals who had borderline personality disorder or suicidal behavior or long-term emotion dysregulation, what you'd find is identity becomes important because there can be a delay in identity formation, which I then draw a circle, another concentric circle outside the relationship circle. And I view this picture of the triangle with 2 circles is that when you're young, you're dealing a lot with emotion, behavior, and thinking, and that goes on for a long time. And then when you're a child, of course, those things affect your relationships. And then eventually get to the place where you start working on identity formation. But that's not really occurring until you're a teenager, according to Ericksonian stages of development.
Right. And then I also think about how the biosocial theory plays into this. So when you said when you're younger, you have that emotion dysregulation. Some people are emotion regulation, and some people can be born more emotionally sensitive, but then they're also influenced by their environments, which is that relational point of view.
Right.
And then eventually that identity dysregulation. So if you have years and years and years of dysregulation, emotional, behavioral, cognitive, and relational dysregulation, you eventually start to have a false narrative of who you are. Your identity becomes quite ruptured.
Right. It becomes very confusing too. So often I think chronologically, if you look at the triangle, infants come into the world pretty much emotionally dysregulated all the time. And then they get regulated by their moms. Like, are you feeding every 2 hours? Are you getting to sleep with someone like a safe person? And then are you swaddle when you need it? Those kinds of things. So you have the environment teaching the infant how to regulate. And then infants start learning behaviors and then eventually start developing thought. And so the idea is that if you have emotion dysregulation, it causes behavioral dysregulation pretty quickly, and that's usually within the biosocial model. So if you, but also what Joe is saying too, is that you can get emotional dysregulation, but then your environment is also dysregulating you more. So relationships can worsen your dysregulation through invalidation. Also, identity, if you look at self-narrative as your identity and you have a lot of shame statements internally, is that also will worsen your emotional reactivity to become behaviorally dysregulated. So all of these things impact each other, I think, developmentally, but like also in the moment.
Right.
And so, but you can also look at this figure of the triangle with two circles as being like a lifetime development of a disorder, potentially, if things are bad enough. So if you think of the emotion, thought, behavior, relationship, identity, and then behind all those words, put the word dysregulation.
Mm-hmm.
So then you can look at that figure, and then you're looking at all those 5 types of dysregulations in those 5 areas, which are deeply kind of how humans, operate.
Right. I like to think of anger. I think most people can remember being angry at some point in their life.
Right.
And, sometimes anger gets kind of a bad rap sometimes. You have to have a certain level of anger in order to help things move toward change. But when we think of anger, we often think of dysregulated anger. And I know at times in my life when I've been angry, so we'll call it emotion dysregulation, I know my thoughts begin to narrow and become more judgmental. So that's what we would call the cognitive dysregulation.
Right.
And with my cognitive dysregulation, my actual emotion dysregulation increases. So they're totally transactional.
Right.
They influence one another, like you were explaining before. But then I'm at an increased likelihood of having some sort of behavioral dysregulation. Maybe it's throwing a dish or having an anger outburst, which is then going to impact the relationship with whomever I'm around at that time, even if they're not the person I'm angry with.
Right.
And then I might become, shameful for my behaviors. And then the cycle just keeps on going.
And so if you extend this idea into looking at like the dimensional characteristics of or diagnoses of something like borderline personality disorder, is it starts to really map onto this extraordinarily well. So if you look at emotions and emotion dysregulation, the symptoms that are consistent with that within borderline personality disorder, which you really could consider basically just chronic emotional reactivity, is affective lability. So emotions, up and down. Sometimes people talk about the idea of rapid cycling or those kinds of that severe moodiness. And that's just basically emotion dysregulation with being anywhere from irritable to calm. We've talked before in our podcast about that idea of like joy and kind of hypomanic-y feel to somebody, but it's not really that. It's this affective lability that you see. The other second criteria with borderline personality in the emotional dysregulation area is problems with anger. So a lot of times it's assumed to be like anger problems, like, oh, they're angry all the time. Someone has borderline personality, they're very angry people. Actually, the flip can be true, where they're so uncomfortable with anger that they can't be angry, or they refuse to be angry. And so what happens is often it's shame directed at the self. So it's still anger, but directed inwards.
Right.
And so they can get to a point where it's extremely difficult to set a limit in a relationship to keep themselves safe when they need to, and can lead to abusive relationships.
Well, and I think that what you're describing really speaks very much to the hot-cold, the, devaluation and the, what's the opposite of devaluation? There's a specific
Idealization.
word. Yeah, idealization. Thank you. Yeah, so the idealization of one individual in particular, and then like completely devaluing them within the next minute. So, I think that's the book, I Hate You, Don't Leave Me, kind of comes from that, where there's this constant push-pull in a relationship. Like, you're the best thing ever. Oh, my God, you're the biggest piece of shit in the world. And that can happen even in a day.
Right. It's just very quickly. If you look at the behavioral dysregulation part, and the criteria that are related to that would be impulsivity in behaviors. So this could be, gambling a lot of money, buying things rapidly, substance abuse problems, things that are really, really quick decisions often that are against people's values in the moment, but probably have a lot to do with avoidance of emotion in that
Like
very
self-injury
moment.
and persistent suicidal ideation.
Right. And then also the other criteria, there's also risky behaviors. So there's an amplification into driving too fast, taking risks. What's interesting is having this like risk-taking behavior, but also being harm avoidant at the same time. Just engaging in behaviors that make them extraordinarily anxious while they're doing it.
Right.
And then also the idea of the cognitive dysregulation of sometimes it's dissociation, having enough trauma, like feeling removed from yourself or distant from yourself, or derealization, depersonalization. Also, there's like shifting perspectives. And these perspectives could be about people, like so-and-so is good, but then something happens, all of a sudden they're horribly bad, or their preferences for what they like in the world might be determined solely upon the context of what relationship that they are in. So it doesn't feel like a consistent point of view or frame of mind.
Well, and the relationships become mood dependent too. I think this leads to a lot of confusion, especially with parents with their kids. And a lot of times I think people are then labeled as like manipulative.
Right.
Where, you might have a conflict with a friend and share that conflict with one of your parents.
And might be really upset as you're sharing it and saying, I don't want to talk to this person ever again.
Right. I'm never going to talk to this person ever again because I'm totally in emotion mind. And that is one of those examples of maybe ending a relationship when you're not in wise mind,
Right.
ending a relationship when you're in emotion mind. And then you might be sharing that with one parent and then you repair and never let the parent know about the repair. And then to the other parent, you might say, oh, I can't wait to go see so-and-so. And your environment can't really keep up with it because it shifts and changes so rapidly.
Right.
And so you can oftentimes become, well, that's that, shifting perspective thing. Like one minute I hate you, the next minute, you're my best friend again. It's hard for your environment to track that.
And often a result, for an example, on like a treatment team would bring up the word splitting, quote, splitting.
Right. Mm-hmm.
And this is what the split is within the person. They don't know it's happening. They don't recognize it's happening. They're not aware of it. It's just that you have two different parties who want to make different decisions from each other because of the internal conflict of the person who doesn't know they have it. And so then their environment sort of like fighting over them. But that's actually not the client's responsibility to be accountable to. It's actually the team communicating more clearly. And then these three dysregulations obviously affect relationships, because if you're behaving, emoting, or thinking in vastly different ways, is that your relationships have a hard time keeping up, like Joe had said. So what you'll find is these chaotic relationships where people are intensely connected to someone, and then they explode or they implode. And there's also this idea of fears of abandonment. So all of this regulation has led to rupture and disconnection and rejection within relationships. So people become hyper aware of loss of connection or of abandonment, whereas we all have, on some level, have to have some fear of abandonment if we don't have autism, basically.
Right,
Like we don't
right.
want to be alone. We don't want to lose connection. And then for these individuals, it's like super amplified, where they're actually afraid of it. It's kind of on their mind a lot. And they end up making a lot of decisions based on their fear of abandonment. And so that's I love you, or I hate you, don't leave kind of thing. That's kind of what they're referring to. And because there's all this conflict in relationships, one of the things we do as humans is we actually use our relationships to identify who we are. Like you could, if you wanted to get to know me really well, you wouldn't have to spend any time with me. If you could just have two of my best friends, hang out with them for a couple hours in an afternoon, you'd have me pretty much pegged for the kind of personality I have and kind of person I am. Because we tend to, as we get older, associate people who are rather similar to ourselves. And that's good and bad, but actually not really just political point of view. What I mean is like temperamentally, like my temperamental traits. Often I have people around me who, if I regulate really well and I'm intellectual or whatever, I'm probably going to have a lot of friends who regulate well and are also intellectual.
Or will have similar values to you. So not necessarily the same values, but similar values.
I think values, yes. So I think like politics necessarily aren't values driven so much. To
Correct.
me, it's kind of indirectly related that way. But you're right. I think that idea of like what I value in life, most likely I'm going to have people around me who value similar things.
And when you were talking about the fears of abandonment, and you said that people are kind of looking for cues of abandonment in their environment.
Yes.
It is almost as though they become hypersensitive to perceived rejection and perceived abandonment.
Right.
So even though the relationship may be fairly stable, the individual, if they have a history of these kind of hot-cold relationships or being left or this chronic loneliness that pursues, they'll be very hypervigilant to perceived rejection. So they're looking for cues in the environment.
And I think what is important to note, I think maybe for dads or males out there, or when I say like you're typically male-minded individuals, it could even be a mother too, is lack of awareness around the fear of abandonment can cause big problems. And how this works is if you're kind of parent where you're kind of calmly connected, but then things get to a point where you just don't know what to do, or you're kind of done with it and you kind of walk off, or you're quiet, you don't say anything. Like someone needs to be validated, it would be helpful to validate, but you're not being rejecting, but you're just not saying anything. You're just looking at someone blankly. That's highly invalidating. And also for people, fears of abandonment it's like you've just disappeared, but you're in the room with them. Or if you walk away, in their mind, it's like you've walked away forever. Like you're done with them. They're not thinking, oh, this is a timeout. You're taking a timeout. It's difficult for you.
Right.
Their mind is like, you're leaving me, like completely. So I think there needs to be some awareness that if you need to take a break from someone who's emotionally reactive, is kind of letting them know that you're kind of at your limit. I need to take a break, and, we can talk about it maybe in 15 minutes or so, but I need to take a break for myself. It's extremely important with someone who has emotional activities, to tell them that, I need a break and I want to connect with you in a couple minutes or however long that is, so that fear of abandonment isn't activated. Because if it is, all kinds of dangerous behaviors and difficult behaviors can ensue.
I like what you said, though, just now. You said that, I need to take a break. I value you. I value this relationship. I want to come back to this, but right now I need to take a break.
Right.
I think that's really important because we don't want people going to the other extreme where they're afraid to set limits for themselves because they don't want to initiate that fear of abandonment in someone else.
Mm-hmm.
You still need to be able to take breaks for yourself, to be able to step away from an intense situation in order to not make it worse, without fragilizing the other person.
Right.
And, I like that part. So it's not like you don't ever get to have your own needs met. It's just that you're also communicating that the relationship is important and you're important at the same time.
Right. And you're almost commenting, you're recognizing there's connection here. And if I leave, we lose connection, but I want to come back, connect again. So you make it more transparent about that you value the connection, you're thinking about it.
Right. And I think that, when you have these chaotic relationships and these fears of abandonment, you kind of almost create the abandonment. So you tend to push people away or latch
Right.
onto them. So, I know we're going to eventually talk about the dialectical dilemmas, but I think sometimes when people are in what we call active passivity or that learned helplessness, you're trying to, not consciously trying, but there's this need for the environment to activate to solve your problems. But then when you don't like the solution that they come up with, you tend to push them away.
Right.
And you do actually start creating abandonment through your behaviors, or people get tired and they leave, which then contributes to that chronic feeling of emptiness. Well, if I hate myself, if I loathe myself, I can't stand being alone, and then I'm doing these behaviors that reinforce that I don't like myself because all my behaviors are against my values. And then in my mind, I can easily find proof that I'm worthless because everyone leaves me.
Right. And so this is how the conflict, the extreme amount of conflict that occurs within relationships then impairs or impacts development of the identity. And so what Joe's been talking about is basically the sense of chronic emptiness.
Mm-hmm.
Like all these rejections, all this conflict over time is because a sense of identity can't really form very well, is when you look inside yourself, it seems empty rather than like if I, as a relatively healthy, you could, maybe do some psych testing to figure out this is true. I believe I'm relatively healthy. Maybe I regulate well certain days, maybe not so well other days. But I know for me, if I have conflict in a relationship or I feel rejected, that I can, really, it hurts and it feels lonely if I want to be aware of the sensation in my body, to be honest. But also I know kind of who I am. Like I know what I'm working on, what I like about myself, what really needs to change. Like I know I have a perceived sense of myself. So I'm alone in that moment, but I'm also alone with me. When you have teenagers in particular, but also individuals who are adults with borderline personalities, there's not a strong sense of self. So when they look inside, they see emptiness, which is quite threatening, which probably also then in turn drives the intense connection in relationships and also an extraordinarily big fear of abandonment. Mm-hmm. Because I could be alone with me if I regulate well, but if I have to be alone with no one, or not have an internal sense of self, that's a very threatening place to be.
Right. It's like I think you've used this analogy before, like being shot off into space.
Right.
Like I'm just eternally out there by myself alone, and I have zero connection. And I do like that you said, so if we were looking at this diagram in our minds, so to speak, that chronic emptiness then will also drive up those impulsive and risky behaviors. So maybe I'm going to have a lot of frequent sexual encounters with random people because I'm looking for external validation. I'm looking for something outside of myself to fill myself because I'm empty. And that's where I use an analogy of like an empty well.
Right.
If my well is empty, if it's dry, I seek something in the environment to fill that well. So that might be reassurance seeking. It might be looking for compliments from other people that I wouldn't believe anyway. They might compliment me and then I would dismiss it because I'm empty.
Right.
And so we're constantly seeking things to try to fill us up. And when we can't, and when those things run out or when they run dry, because let's face it, people can only give you so much reassurance that they're not going to leave you until they leave you. And so, pouring water into a dry well might work for a little while, but once it stops raining, your well dries up again. So that's why when we're working with the girls, and I use that analogy of digging deeper, we have to dig deeper. We have to spring our own well. We have to be okay being ourselves. And the other part of this that happens that we see frequently is that our residents will give something that they don't have. So they will give more care and compassion and loyalty to people who don't deserve it, who are actually hurting them, than they would to themselves.
It's true.
And they feel selfish if they validate themselves. They feel selfish if they set limits. So that's only propagating this concept of, being empty and alone.
And the other aspect of identity formation is role diffusion. That's a very Ericksonian thing, that you're trying to build identity as a adolescent, and if you don't develop identity, then you have this role diffusion thing that happens, which is not really having a clear concept of your traits and of yourself. Sometimes I joke about the idea of the 40-some-year-old guy working at Hot Topic and looking the part. You're like, it's kind of unusual why that happens. It feels like, you're kind of in a two-dimensional way tagging on to like, I am this person, I am this thing, but usually adults aren't easily defined by what they look like. Those kinds of things are complex, and we've integrated multiple complex parts of ourselves. But when you have role diffusion, it feels almost like a cardboard cutout of a subgroup or a genre or something like that.
Right. So it's superficial. That's what I was looking for.
Yes.
So these things are all interconnected. All the dysregulations completely interconnected. It sounds super complicated, right? This influences that, which then influences the first thing. And it could be this like ongoing, I like to think of it as like a big giant ball of yarn that's all twisted up, or like a necklace that has a knot in it. You got to try to figure it out. Mm-hmm. The cool thing about it is with skills, we can stop this process at any given point.
Right.
So the number one thing, I'm going to kind of just talk about a couple of skills. I know we haven't talked about all the skills completely, but this is why I think DBT is so amazing. Is it takes something super complicated and it just activates somewhere. At some point, you just activate.
Right.
And so obviously this entire process requires mindfulness. So if we're not aware that we are emotionally dysregulated or behaviorally dysregulated, or we have interpersonal issues, we can't really change or fix anything.
Mm-hmm. I think also it's important too that mindfulness itself maps very strongly onto identity formation. Mm-hmm. So it's probably more, it's important everywhere, but extraordinarily important there, because you having mindfulness about your internal experience to the world around you really starts showing you who you are, like what your values are, what's important to you, what's not important to you. Because if you're not able to pay attention to your body signals, then you have really no idea of knowing who you are. Mm-hmm. And so that level of just doing a lot of mindfulness. And to me, what is interesting is I have had worked with young women who had believed themselves to be transgendered. Mm-hmm. And maybe a couple of them have been, and I do think that is somewhat statistically rare, but I think also it tends to be overreported in the clients that we work with, partly because of identity formation is delayed a bit. And so if you have if you're not identified strongly, like it's hard to identify with my orientation, it's hard to identify with gender even, or identify with religious belief. Like, it's hard to identify with anything when you're behind schedule with development. Mm-hmm. And so not identifying with something can be easily labeled as, well, I'm trans, or I'm bi, or I'm pansexual, or these topics. And it's not to say those things aren't true and don't exist. I believe that they can. It's just that residents who don't regulate well and have a lack of identity formations, they're going to grab onto those because they seem to make sense, because they don't really feel identified strongly anyway. Mm-hmm. And at least 2 young women I've worked with had come to the program, believe themselves to be transgendered, and spent a lot of time doing mindfulness, because that's just what we do to help regulate emotion. By the time they left treatment, they recognized that they were gay. Mm-hmm. And actually both of them identified with more masculine traits as far as like their psychological makeup and emotional makeup, and also identified as being gay. So then it's like that more, like, I guess a masculine version of gay is the best way to put it. And then they kind of came to terms with like, well, that's how I identify. That's maybe who I am now that I'm identifying after a lot of mindfulness into how my mind works.
Right. Yeah, I think that's actually really important. And, to be super clear, as we're working with individuals who are struggling with identity formation, there is no, for me specifically, and I think for you too, but I don't want to speak for you, there's no right or wrong way. We want to help individuals really be able to identify with a sense of self that is congruent and honest to them, so that, if they did continue to identify as transgender, that would be embraced. But whatever it is, that is them, truly them, rather than this like seeking and searching. Mm-hmm. We see a lot of seeking and searching, and a lot of decisions that are made that are against people's values. Sometimes those are sexual behaviors, sometimes those are, eating disorder behaviors or self-injury. Whatever it is, when they really tap into themselves, they can fully embrace themselves. That's what we're trying to go for. It's not like one thing is right or wrong or valid or not valid. It's, well, who are you?
Right. And I think for me working with residents, if they come in and there's a really strong need of theirs, I might say, well, maybe. I'm not saying no, I'm saying maybe, and let's see. Like, we're not really going to focus on that too much right now. We're going to push more for this more and more mindfulness, and that happens to be the case. We'll just be more clear about it. Mm-hmm. And it's also possible that by doing this, you find out that, you're not, quote, typical, whatever typical is, but a lot of times residents find out maybe it's an orientation, type thing, or maybe that they don't identify as being as feminine as their, friends are or whatever, and that's also fine and okay. But it does confuse things when you're not like everybody else,
right,
in whatever way that is.
Exactly. So then if we kind of bring it back around to skill use, so obviously we need mindfulness for pretty much everything.
Right.
But distress tolerance is another really important aspect of things. So the distress tolerance piece of it can be when we're emotionally dysregulated. How do we, just tolerate some of the distress? So doing our tip skills obviously is a great way to be able to tolerate distress long enough to be able to shift and regulate the emotion.
Right.
Stop, obviously, before engaging in impulsive, risky behaviors. So there's a lot of different places that we can apply skills to start changing the trajectory of all of this.
And those skills Joe's talked about are often used to prevent behavioral dysregulation,
right,
risky, impulsive behaviors in the moment that make things worse. Emotion regulation itself, or emotion dysregulation, is using a lot of emotion regulation skills, which have a lot to do with like caring for the self, also like recognizing emotions in your body and being able to tell them apart. So our action urge is different from different emotions, thoughts are different, consequences for different emotions are different as well. So having real good recognition that you can tell the difference between sadness and shame, or shame and guilt, and these become quite important to be able to do.
Well, and the other part of emotion regulation skills, so yes, they help regulate emotion, but a lot of it is also around thinking. So challenging myths and beliefs, checking the facts. Those are all emotion regulation skills, but they deal with a cognitive piece of the emotion regulation.
Also, yes.
Yeah, so mindfulness of current thoughts, that's another good place for that. But then we have our interpersonal effectiveness skills. So if I have a series of relationships that I'm in that reinforce my negative self-talk or are very toxic and detrimental to my long-term recovery or just my general happiness, if I'm not someone who is, diagnosed with anything in particular, but I still might have a lot of toxic relationships. So then we have our interpersonal effectiveness skills, dear man, give. Fast actually could be part of the identity dysregulation. So when I'm being fast, which will make sense if you listen to future podcasts, but fast is our, self-respect goal in interpersonal relationships. So to help improve our sense of self, we would want to, be fast. We talk about accumulating positives in the long term. That's a really great way to be able to identify our values, what we stand for and what we believe in. Self-validation is a huge piece of identity regulation.
Right.
So a lot of challenging, again, back to challenging myths and beliefs, especially if we have a lot of core shame thoughts. So you can see that skills can be applied pretty much anywhere to help stop the cycles of dysregulation with ultimately the goal of improving self-identity.
I think also too, which we've talked maybe not so much about just yet, but the idea of dialectics too. So the philosophy and principles of DBT I often put it in that kind of like cognitive category, even though it's hard, because I think as you talk about things, you find out they're related kind of all around, like everything connects on some level. But the idea of dialects and that you can find the middle path, that we often go to polarities when we're dysregulated in any type of way, and we got to try to find our way back to the middle. And so if we're good at seeing that and good at practicing that, it's actually harder to kind of get knocked off balance into being dysregulated if you can see multiple sides, multiple perspectives. And so I think that philosophical or principles-based way of viewing things, I think, is really quite helpful. And I tend to view that as cognitive, even though it still has a lot of emotion and emotional components to it.
Yeah, definitely. And being able to accept reality as it is also a huge piece of pretty much every one of these dysregulations. I have to be able to accept reality as it is without telling stories about how reality should be or, whose fault it is, that kind of thing. So reality acceptance skills are a huge part of all this too.
Absolutely. Well, this has been an episode of All Therapists Are Jerks with Ulland
and Jo.
Thank you for listening.